Hello, viewers. I am Dr. Tahir, and welcome back to Youthful Medicine. I am your rheumatologist and obesity medicine specialist, and today I will be talking to you about managing weight loss medication side effects. Uh, we know that Zepbound, Wegovy, these medications have been FDA approved for weight loss treatment, and they work through mechanisms on our GI system. And obviously, we do find that there are some challenges with gastrointestinal side effects. So, one of the most common side effects that I hear from my patients is nausea. So, and obviously, a lot of people are very knowledgeable now about that Zofran is one of the medications that can be given for nausea treatment. And uh, I want to bring up a discussion about how to manage nausea by making changes in your diet, and also when using Zofran, what are the things that we should be looking for to avoid any complications. And one of the common concern that is brought up when doctors are prescribing Zofran and you are on any other medication which can have an interaction, um, our computer systems, they alert doctors about a concern called QT prolongation. And we have to make sure that we go through the list of the medications and make sure that this new prescription, which is Zofran, is safer for those patients to be taken along with other existing medicines. So one common medication that patient population, or my patient population, is on antidepressants, the SSRIs. Indeed, when I prescribe Zofran, and which is very effective for nausea and relief of their symptoms, combining with antidepressant, I always get a pop-up in my computer electronic medical record. Look, stop here, talk to patient about the risk of QT prolongation. And I thought I'd share with you guys here. So it's a QT prolongation is a finding on the EKG. Electrocardiogram is divided into PQRST waves, and there's a prolongation or slowing of the transmission of electrical conduction from one wave point to the other, and that prolongation is what condition is called QT prolongation. It's a potentially dangerous condition of a rhythm of the heart. So in this video, I want to talk and emphasize on what QT prolongation is. It's basically, an EKG finding and what can happen. So QT prolongation is basically can be a symptom where it can present as a symptom of palpitations and your heart sinking or not feeling well or pressure type symptoms, and sometimes you won't not know it, and it could be problematic without being checked out by the EKG or heart monitor. So again, the QT prolongation refers to a delay in the heart's electrical activity system, which can lead to an abnormal heart rhythm. It is important to monitor the patients who are taking medications that can increase the risk of heart attack. The heart arrhythmias or rhythm problems, including medications like Zofran, which patients might be taking because they are on weight loss medicines such as Wegovy, Zepbound, Ozempic, Manjaro, sort of things. And when they are already on a certain antidepressant, medication interactions is always a concern. Safety first. So making sure that when you are on a medication, that you and your doctors are diligent in kind of reviewing those with you. So what patient population is at a risk of this issue? Well, combined use of medications can increase the risk of anyone who has this. So certainly, while the risk of QT prolongation with the antidepressant is generally not high, it can still happen in higher doses when you're combining multiple medications, and individuals with risk of factors such as electrolyte imbalances or pre-existing heart conditions. Zofran commonly associated with QT prolongation. At higher doses, when combined with other medications or given intravenously, it can be pretty concerning. So the risk is also increased when you combine with conditions such as low potassium levels, low magnesium levels. And some of my patients who are on weight loss treatment, I encourage them to make sure that they are taking medications that are providing them minerals and micronutrients such as potassium and magnesium, so that they are not deficient in it. Because I've seen patients having fatigue, muscle aches, pains, and other symptoms that can be underlying problems triggering them to develop arrhythmias, or prolongation of QT. And also congenitally long QT prolongation is also another condition. So people can be born with a predisposed condition where their rhythm is already slow. Now you combine those patients with Zofran, and they are on antidepressant, and there's no baseline EKG ever done, that can be a problem. So making sure that when combined medications are given, that you either hold the other medicine while you're using the first one, or your doctors can order an EKG for you. It's a quick 10-minute test, and they can basically see what's your baseline is, and after being on the medication a week later, a few days later, you can recheck the EKG to make sure that the QT has not gone up, and you're not at a higher risk. Monitoring electrolytes, specifically potassium and magnesium, is really important. And if you have already underlying cardiac problems or heart diseases, make sure that you are being careful about adding more medications to avoid any of these complications. So baseline EKG and regular follow-up EKGs are both important while you are on medications. Adjustment of dosages is also a good idea, because you can always reduce the dose of the medications if you're on a very high dose of one medication like antidepressant, but you think you can talk to your doctor and see if they can adjust the dose is important. And always safe communication with your doctors is important. Also, taking some supplements can also trigger these QT prolongations. So make sure that you are talking to your doctors about your over-the-counter medications and supplements that you are taking. If you have a higher QT prolongation than an average person, maybe these medications are not really that useful for you. So again, I would say if you found this video useful, please share it with someone who may be interested in listening to this content, and also like and share and subscribe to my channel so that I can continue to give you insights on weight loss, treatment, lifestyle medicine, and managing chronic conditions as well. And yeah, and take care of yourself, and see you in the next video.